Hi, I'm Lynn Johnson. I'm moderating for Haley Ellis and Christine Marie George on the topic multi-sectoral as part of the impact alphabet, which is a novel idea. I think it's working. So first off is Haley, who's ready to share her screen. And Haley is a public health researcher working actively in WASH topics. She works for WorldVision as the WASH program manager for Asia, a number of countries. And she leads their partnership with Procter & Gamble, where she manages clean water projects in roughly 15 countries. So we're pleased to have Haley with us. Hi there, Haley. I see you.
Hi, can you hear me okay?
You're ready to go.
Yes. Great. All right. I'm going to share my screen. Hopefully this comes across.
Okay.
All right. Are you able to see?
It's coming. There we are. Yep.
All right. Do you see full screen? No?
Yep. Now we do.
Okay, great. Wonderful. Well, just let me know if, I don't know, audio or something doesn't come through.
Okay, well, let's target 15 minutes and some fuzzy around the edges on the time. Okay.
Sounds good. Thanks. Well, thank you, Lynn, for that really warm introduction. Yeah, as he said, my name is HayleyElling. I'm a relatively new member of the WorldVision team. I've been on board for about a year, so I'm still kind of coming up to speed on all things WorldVision, but I'm really happy to talk about this topic and really how WorldVision kind of sees multi-sectoral approaches and how we can see, you know, those approaches as having more impact and more sustainable impacts over our WASH programming. So I'm going to dive right in and kind of talk a little bit about our perspective and how we incorporate multi-sectoral approaches and really just give an overview of our programming as well. So in my role, as Lynn kindly said, I do lead our WASH work in the Asia Pacific region, which is, it consists of about 6 countries, but we have kind of a larger programming aspect within our work. So how we do our WASH programming is really by establishing kind of 5-year WASH business plans. And so currently the current business plan that we're working in is actually called our Roadmap to Impact. And so it's a plan that really establishes, you know, sets out 5-year goals. So it's from 2021 to 2025. We currently just wrapped up the 2nd year of the 5-year WASH business plan and have 3 more years before this one kind of concludes. But what this document does is it really outlines WorldVision's organizational commitment to invest $1 billion over a 5-year period to extend our WASH impact over 41 countries, really emphasizing and trying to reach the world's most vulnerable, especially in fragile contexts. So the document is actually linked here. I'm not sure if anyone has access to that link, but it's a 78-page document. It's very elaborate if you want to take a deeper look. But there's 4 main goals that we focus on within the plan. The first is to accelerate universal and equitable access to WASH. The second is to deepen focus on the most vulnerable people. The third is to demonstrate sustainable impact. And the third is leveraging the $1 billion to mobilize financing for WASH services. And really, what we focus on that one is that if we provide funding to different countries, we really do expect or try to support that they use that funding to get more funding to be able to kind of leverage and increase the impact of the funding that is originally provided. So again, you can kind of take a deeper dive into this large 78-page document to really understand more of the nitty-gritty of how we achieve these goals. But for today's session, I really wanted to focus on just, you know, one aspect of the plan. And so within our programming, we really do aim to align every component of our work, you know, whether that's programming, focus areas, quality initiatives, financing plans, core values, WorldVision, the overall, you know, organization vision. But specifically, I want to focus on this impact multipliers. And what these are they really enable us to leverage our organizational distinctives to meet and exceed our WASH global goals. And so really an impact multiplier is kind of self-explanatory, something that multiplies impact over time. But it's a really critical component of the way that we operate and is key to multiplying the reach and effectiveness of our WASH work. This really enables us to leverage our organizational distinctives, really meet and exceed the WASH goals that we have year after year for each country, and elevate our leadership ability. So there's many impact multipliers that we discuss and that we work on quite frequently, but there are really 5 main ones. So the first is focusing on strategic partnerships and collaboration. The second is multi-sectoral approaches. The third is long-term commitments. And then the fourth is global footprint and localized expertise. And then the last is faith engagement. So I bet there is no surprise which one I'm going to focus on today, but that would be multi-sectoral approaches. And so when we think about multi-sectoral approaches, there's so many aspects that we could focus on, or that, when I was putting this presentation together, it was really hard to kind of narrow down what multi-sectors and what other sectors I wanted to focus on. So I'll just start, this slide off by saying that this is in no way representative of all of the sectors that we're working in, but just the ones that I wanted to highlight today. And so there's 4 that I really wanted to point out. So I think the most common one that has a lot of attention and most people think of when they think of multi-sectoral is the collaboration of WASH and health. But there's also WASH and nutrition, WASH and livelihoods, WASH and child protection, and again, like I said, numerous other areas. But focusing in on WASH and health, I think in a lot of aspects, access to water, sanitation services, and hygiene services not only overall improves better health, but a lot of times when we think of health, we think of healthcare, we think of healthcare facilities, and how, thinking about how these WASH services within healthcare facilities can really increase and, reduce hospital-acquired infections, how it can improve healthcare quality, a quality of culture, how it can provide safe and dignified care. And so in a moment, I'll actually go into an example of our WASH and healthcare facility work, focusing on WASH and nutrition. The access to WASH services help children just be better nourished, prevents chronic diarrhea, which can lead to enteropathy and malnutrition. A lot of the programs that we work in within nutrition, if there's no safe water, a lot of those, nutrition programs really can't function. It's a really big barrier to having success within nutritional programming. So an example that I'll talk about within that aspect is actually baby WASH. And then WASH and livelihoods, having WASH services within a community can really empower that community, not only improving water security, to reduce hunger, to reduce poverty, to reduce malnutrition, but it can also lead to building resilient and economically empowered environments, and really safeguard livelihoods. So an example I'll go into in more detail is also talking about WASH microfinance, WASH microloans, and business centers as well. And then lastly, we have WASH and child protection. So this is kind of really affluent in the areas that I work in, specifically in the Asia Pacific region, but aligning our WASH programming to different child protection programming, whether if that's collaborating with the education sector, is really critical for child protection, and really boosting either school attendance. It can really prevent and protect children from either injury or violence. And then an example here would be, we would do a lot of this programming in India, for example, where communities in different households, if they have access to a latrine or some type of sanitation facility, it really helps, prevent violence against women, violence against children, and really, again, increases livelihood. So for the sake of this presentation, I'm going to focus in on these 3 areas. So the first one is on WASH and health, talking a little bit more about WASH and healthcare facilities. So actually back in 2017, WorldVision actually partnered with the Water Institute at UNC and actually did a study that they collected data from over 2,000 healthcare facilities from across 14 countries. If anyone is familiar with this, I think it's kind of well known as the 14 country evaluation. So if there's, if you're looking for more information online, there's a lot of publications in relation to this study. But this study really was a cross-sectional study of WASH infrastructure, supplies, and behaviors across a subset of randomly selected rural healthcare facilities in 6 out of the 14 countries. And really what was kind of revolutionary about this project was that at the time, we really did take a deeper dive into looking at different types of health indicators and wanting to track different types of progress related to health, whether that was related to waste segregation in healthcare facilities or environmental cleaning within healthcare facilities, which at the time didn't have a lot of focus and still could require more focus as in the current work that we're doing. But as a result, between this time period of 2017 and 2021, over 2,000 facilities were actually reached with at least a clean water source, and many others were actually included with key aspects related to waste segregation systems in place, environmental cleaning policies and protocols, and things like that. And all in all, what we kind of took away from this research is that WASH in healthcare facilities is really not something that can be done in a vacuum, because the healthcare facility is a key and integral part of the community. And really a key component of the healthcare system. We often say when we do our work in WASH in healthcare facilities that a healthcare facility isn't a healthcare facility if it doesn't have WASH, because without having WASH, there's no way that we can ensure safe and dignified care, infection prevention and control, environmental cleanliness, a clean or hygienic culture within the healthcare facility for staff and patients and visitors that attend the healthcare facility. It can't ensure safe maternal and child health, and then let alone, bigger items like universal service coverage or thinking about WASH from, a bigger outside of a community aspect. So taking another deep dive into a specific case study, we actually did a project from 2016 to 2020 in 2 districts in Mali, where we aimed to provide 40 healthcare facilities with sustainable WASH services. And this project really aimed to integrate and have an integrated approach, really collaborating a lot of different stakeholders. So, having community members, having government officials, having not only health officials, but WASH officials and different partners and NGOs really collaborate on this study to provide a lot of different perspectives on really what could be the most impactful in terms of our WASH and healthcare facility work. So in 34 healthcare facilities, including 33 community-based health centers, including 1 district hospital, they actually were able to receive a complete WASH package that met national and World Health Organization standards. And what I mean by a WASH package is, aspects and components of not only just water, but water and sanitation, hygiene services, and waste segregation and environmental cleaning. 22 of these health centers actually achieved the Clean Clinic status related to the USAID's Clean Clinic approach, which was compared to the 9% at the beginning of the project during a first inspection. And then one last really amazing outcome that at least I saw was really involving other stakeholders within the healthcare facility. So while 34 healthcare workers were trained on behavior change communication, they also actually brought in different aspects and different people to have different types of training. So there were 120 community health workers that were trained. There were 10 midwives that were trained and equipped with tools to promote good hygiene practices. And then my personal favorite, there were 63 cleaners and cleaning staff that were trained on surface, yard, and latrine maintenance, as well as safe waste practice collection, incineration, and the maintenance of those incinerations. Moving on to WASH and nutrition, I'm going to talk a little bit about our baby WASH intervention. So baby WASH is actually a program that aims to connect maternal, newborn, and child health, nutrition, and early childhood development interventions with WASH to achieve better outcomes and greater health and impact for mothers and children within their first 1,000 days of life. So we've been doing baby WASH programming for about 10 years now, but we have kind of 4 really strong case study examples of where that program is being implemented, including in Uganda and Kenya and Zambia. And then one that we're actually extremely excited about is actually happening in El Salvador, where we've actually had a lot of government involvement, specifically from the Office of the First Lady. So in El Salvador, the First Lady of El Salvador is really passionate about maternal and child health and well-being, especially within early life. And so we're really hopeful that this project, which just launched back in June, is actually going to go forth over the next couple of years and then eventually take ownership from the government and from the Office of the First Lady. But in order for these projects to be really successful, there's a lot of inputs that are needed, specifically around nutrition. So I've listed some here, exclusive breastfeeding for the first 6 months of life, proper nutrition, and really, allowing nutrition to be a component of this is that we really are aiming with WASH interventions is to reduce the pathogen load in the environment and overcome the causes of gut disinfection and infection diseases such as diarrhea, acute respiratory infection. Adequate nutrition really requires access to the right quality of food and quantity of food, as well as optimal, maternal, infant, and young child feeding and care. So moving on to the last example that I'll speak about is actually WASH and livelihoods. So as part of WorldVision's WASH programming, a lot of communities are educated about proper WASH practices and their effect on good health. It's kind of just the basic of WASH programming. But what we found is that this often leads to a lot of frustration within the communities, mainly because they don't have the financial resources to change their circumstance. So what we started to do back in 2017 and beyond is we started pairing microfinance approaches with WASH interventions to support low-income households to gain access to sustainable services. These microfinance initiatives really provide low-interest loans. Usually they're very small amounts, kind of up to $1,000, something along that line, that enable families to build or improve WASH facilities such as water tanks, which you can see pictured on the right of the slide, latrines, hand washing stations, and really improve health and restore dignity. So in 2021, we actually piloted this project in Kenya in 2 different districts. So the first one was actually to establish 2 WASH business centers. And so a WASH business center, the concept around that is that it's a market-based solution for better access to WASH products and services to meet different consumer needs. Usually it involves getting community groups together as well as the private sector, but essentially to set up a one-stop shop that essentially sells WASH products. So whether that's soap or latrine slabs, different types of supplies for water systems or latrines, hand washing facilities, reusable sanitary towels, water treatment supplies, and so on and so forth. But then also the second goal was to also use these centers to open the market for microfinance loans to households to fund WASH improvement, so that not only did they have access to financing, but then they also had access to a market where they could buy the supplies that they needed in order to improve their own livelihoods. And so from this project ran for roughly a year, a little over a year. So from February 2021 to July 2022, we actually granted 349 loans, which were granted, which is a little bit over a value of $97,000, which reached over 4,800 people. So it was a really successful launch of this project, which we really hope to implement in different regions and different areas within our work. But one of the main, success factors here was really, the business centers themselves, but also training for community members and practicing in collaboration for marketing and promotion, which kind of sounds like an obvious result, but, having those components of marketing and, business was definitely something that was definitely thought through, in various ways. So in summary, at WorldVision, we have our 5-year WASH business plan that recognizes the importance of multi-sectoral approaches as a critical component of sustainable impact. But we, and I myself personally, really believe that WASH needs to be incorporated into as many sectors as possible, because it really affects the lives and families of children in so many different ways. And I know right now there's so many organizations that are doing a lot of different work in different aspects, but there's still areas that we can grow in. There's areas such as WASH in emergencies, climate-related aspects with WASH, looking at WASH through a gender lens. There's so many different areas that we need to really consider in order to have more sustainable and successful impact for our WASH goals, because WASH really touches so many different things. And then also, oops, sorry, I thought I heard someone say something. But also these multi-sectoral approaches really means engaging with a range of different stakeholders. So while we're talking about different sectors like health and nutrition and livelihoods, we also really need to think about who is seated at the WASH table, and really who needs an invitation in terms of stakeholders. So looking at different organizations, ones that we haven't really either engaged with or talked about before, but looking at stakeholders outside of what is traditional. So we talk about government stakeholders, we talk about NGOs, but thinking about stakeholders or people like cleaners in healthcare facilities, people that might not be considered in WASH interventions or health interventions in the past, looking at finance as experts, thinking about marketing and different aspects of business management, looking at nutrition researchers, academic institutions, and really working really collaboratively within those different sectors, but also within those different stakeholders. And then lastly, I think, this is pretty obvious within this breakout group, but multi-sectoral approaches and collaboration in the areas that I just mentioned, health, nutrition, food security and livelihoods, agriculture, economic prosperity, child protection, and education enable greater impact because WASH is not a standalone sector and can't be a standalone sector, which is why I'm really thankful that everyone here, I think, is aware of that and working in so many different aspects. So with that, I believe that I'm at time. So I'm just going to probably hand it back to Lynn here for any questions, but I do have my email listed here as well as my WhatsApp. WorldVision kind of talks exclusively on WhatsApp, so feel free to reach out at any time with any questions. And I'll hand it back over to you, Lynn.
Thank you, Haley. Spot on, time-wise. And those of you online, you could enter questions into the chat box. I see one open chat. Maybe that's the request. And in the room, we have questions.
Yeah, can you hear me okay?
Yep.
Here.
Perfect. Hi, my name's Samantha. Thank you for your presentation. It was fabulous. I'm a researcher, lecturer, mostly in the broader scope of international development and organizational management within that, but obviously WASH, as you just pointed out, is infused in every sector within international development, so it's always coming up in my work. But more importantly than that, I'm a self-proclaimed connector, so I work with a lot of indigenous NGOs in East Africa, and even small NGOs in the Metro Denver area where we are today. And as you know, and as you mentioned, there are so many organizations existing in this space. We probably have 10 plus here today with us in Metro Denver, and many more virtually from across the world. And so my question is less about the multi-sectoral issue, but more about your last point and who's not being invited to the table, and how does WorldVision go about finding those underutilized partnerships, organizations already doing this work, but in very specific communities and the organizations that are local to those communities. I know I work with a handful, and I'd love to be able to connect them with WorldVision someday. So I'm just curious if you could speak to how WorldVision, I know you're not a partnership coordinator, but if you have something you could speak to about partnerships and increasing partnerships with local entities.
Yeah, that's a great question. Actually, that's kind of been something that I've really tried to take a deeper dive into recently over the past couple of months, because it's an area that I don't really understand how we do well either, because as you said, I'm not really involved with partnerships, but from my experience, I do lead one of our partnerships with Procter & Gamble. And so I can kind of speak to that. I can't really speak to other partnerships because I just don't know. But, we're always there within that programming. There's so many different organizations that do similar things. And so I think largely what we do is we try to really understand, at least from my perspective, there's so many organizations that I just don't know that exist. So within certain programs and in certain countries, I really lean on a lot of our field offices and really try to really frequently and encourage them, because the connections on the ground are really ones that I feel like can be built and strengthened over time. So usually within, I check in with a lot of the field offices that I work in every, week or two. And within a lot of those calls, trying to ensure and trying to ask them, you're doing the work on the ground. What organizations do you see that are also, are you collaborating with? Do you see them doing work in similar areas and similar spaces? And, trying to encourage them to really, reach out, trying to see, more connections, how we can do different types of programming together. So From my perspective, I'm not sure if that really answered your question, but I think my approaches to that is really trying to encourage the field and then trying to find other people working in that space within those areas and trying to make the connections there for the field teams. And then, as my role as program manager offers support and, encouragement, bringing on either leadership or other people to really develop those conversations and connections and try to encourage meetings and things like that. So that's a little bit of how I feel like I approach that.
Can you see the chat box, Haley?
Yes,
And
so there are
question there rather than me try to repeat it?
Yeah,
Maybe in sequence.
I can read it if you'd like.
Okay.
It's a question from Mary Eggert, saying great overview. This question is on qualification of projects. Do you have a checklist you could share for fundable projects?
Yeah, that's a great question. We kind of do have a checklist. I can share it. Maybe I can share it with Lynn. He can distribute it. I'm not exactly sure. Maybe put it in the chat. But yeah, we kind of have a checklist of different things. It kind of goes through a rigorous review and qualification process. And then from there, we kind of move forward and look for different either funding opportunities or donors and whatnot. But I believe we do have a document that kind of explains, the different steps involved with that, which I'd be willing to share. So yeah.
I think chat box would be great if people could access it.
Great. Yep.
Welcome to send it to me as well, but
Okay.
I'm not as connected, so to speak.
Okay,
Is there
great.
other questions in the room? So maybe the next one that's online.
Yeah, I see.
Patty?
Where WASH centers in within the WASH business centers are. So I believe they're in, I can actually put them in the chat. They're within I'm not exactly sure where this is. I believe it's northeastern Kenya, but the Koala district is mainly where we're implementing this program. You can put it in the chat if that helps. Koala district. And then I see another question related to, does WorldVision US have remote fellowship programs for graduate students? If yes, what are the processing timelines? I believe that we used to have this pre-COVID. At the moment, we don't have it since COVID hit. We actually are operating with a couple fellows already on our team. But I do believe that in the next year, there will be opportunities for fellowships. They're just not really being publicly shared or advertised yet. So what I would recommend, if there are any types of fellowships or job openings like that for grad students, it will be posted on our page for that. But I do believe kind of starting sometime next summer, we will be looking for fellows to join the team. So just, I guess, keep an eye out for that coming in the future.
Okay, I think time-wise, apologies to those who have entered questions. Maybe that can be some sort of follow-up. But Haley, congratulations on a great presentation.
Yeah, thanks.
Very engaging and thorough. What a job you had. What fun, huh?
It's a lot of fun, a lot of moving parts, that's for sure. But thanks for having me. I'll turn it back to you.
Thanks very much, and have a great weekend, by the way.
Thank you.
Okay,